Good morning. Welcome to the Katy County Health and Human Services Committee. Before we approve the minutes of the last meeting, I'm going to add an agenda item regarding a child care proclamation that will be added or recognized at the time of doing some other proclamations. So just don't be surprised by that. So you got the minutes of the last meeting in your packet. So I'd entertain a motion for approval of the minutes.
I will move that we approve those minutes.
Commissioner Nissen moves on the minutes. Do I hear a second?
I'll second that.
Commissioner Anderson seconds. Any discussion? Hearing none, all in favor signify by saying aye.
Aye.
Both same sign. Motion carries. Thank you very much. There are no agreements or contracts to deal with, so we're ready for the general business discussions. And before we move on, you see on the agenda that there's going to be a short tour of the remodeled WIC area downstairs. So we're going to try to get out just a little bit early so that we can go down there and be back up here in time for a regular board meeting. Trish, Veteran Services update. Welcome.
How's everyone today?
Very good.
Well, thank you.
Good.
How are
So-
you?
I'm getting around. Every day is getting better, so. Just came to give a brief update on what's been going on. As you know, not a lot for a lovely year we've had, so. The VA is now giving COVID shots on a walk-in basis. So we've been encouraging our veterans, if they haven't gotten them locally, we'll give them a ride up there to get their shots. And our transportation is up and running. The problem is the VA is doing a lot of virtual appointments. In fact, I have one today that's video. They aren't seeing a lot of people, so. But we are up and running if our veterans need rides. We received, the state of Minnesota approved $6 million in grants due to COVID-related distance learning, or if you were diagnosed with COVID. Katy County brought in $167,000 from those grants, and that is closed now because all the money is gone, but that's a pretty high amount for Katy County. County Fair has contacted me. We're up and running again this year. We're gonna have our veterans meal. Pretty excited about that. We are doing our Stingers Veterans Night again this year. It's gonna be June 19th, and that's a Saturday. There'll be fireworks afterwards. The VA has really opened up community health care. The problem with that is I myself am going through this. If it's community health care, it's taking about 3.5 weeks to 4 weeks to get it approved. So I'm waiting on physical therapy to get approved, and that's just how long it's taking. So it's out there, that's good. Our older veterans don't have to make the trek up to St. Cloud, but it is taking some time. We are currently, me and Annabeth are working on our Veterans Advisory Board. We haven't had a meeting in over a year due to COVID. Looking at the list this morning, we've lost quite a few members. So after I told Annabeth after the meeting today, we were gonna sit down and discuss on, do we wanna add more members or just keep it the same and have a lower amount for now, just to get started and get to meeting again, because it is important that we meet and keep everyone in the loop with the local clubs on what is going on. Coffee with Veterans is going again at the community center on the first and third Monday. And last but not least, we have a new van driver. Both of our van drivers retired this past year. The new van driver is Dave Seimer, and he is doing it solo, both trips. So we welcome him. He's doing a fantastic job.
Thank you. Any questions or comments for Trish?
Just the time on the Coffee with Veterans. Did you say a time?
I think it's from 9 to 11.
Any other questions or comments? Commissioner Gardner?
Thank you, Mr. Chair. Trish, thank you for everything that you do for our veterans. Are you seeing people in your office currently?
By appointment, or if they come up to the door and we don't have anyone in there, we are.
So the
Yep.
best thing to do would be to make an appointment.
To call and make an
Call
appointment.
the office and.
And mainly that's to make sure that there's someone there. You know, I have appointments, can be out of the office, and if Annabeth's out on a break or at lunch, and I hate for someone to drive out here and then not have anyone in there because we're on a break, or like I said, one of us is gone for the day.
Sure. And then in regard to your Veterans Advisory Board, if you find there's anything we can help you with, just let us know.
We're just excited to get it up and running again. It's been a long year, and our Veterans Advisory Board, I know we can do Zoom meetings, but you have to look at the age group.
Yes.
They would never be able to figure it out. I mean, maybe some of them, but
Well, and I'm thinking of a couple of younger people that might be a good fit
yep.
for you as well, so. All right, thank you so much.
All right, thank you.
Thank you. Commissioner Gardner. Berg.
Oh, sure. Thank you, Mr. Chair. A follow-up question on the advisory committee. How many people do you have on it now, and what's your capacity? And
We had about 12 on there, and right now we're about down to, 9, which I think is still a good number. There's good representation throughout the whole county, so we don't necessarily have to have 2 people from Spicer and 2 from New London. If we just have one person that can bring back the news to their clubs, that is adequate.
thank you.
I have a question. I think it was about the time or shortly after the pandemic started, there was an issue about volunteer drivers, and I don't recall if that was just related to the vans or using personal cars to help bring somebody to appointments or whatever. Is that still an issue?
No,
Okay.
it is not, because we have a driver now and he's more than willing. In fact, Friday, he's going to get our Bronze Star markers for us because we don't have a trip going, so. And as for anyone that needs an appointment, he's willing to take them any day.
Okay,
Add it on Sam.
very good. Any other questions?
$20.
Well, then thank you for the,
Thank you.
for the presentation, and be well.
Thank you.
All right. Healthy Communities Health Promotion update. Jody. And if there's others, come on up. I have Jody down as the presenter here, so.
Yes, thank you. Good morning.
Good morning.
Take this off. Okay. Thank you so much for having me. My name is Jody Ammerman, and I'm one of the public health nurse supervisors, and along with Denise Kriegerbrink, who you know. I also brought along 3 of our public health staff with me. We have Arfon Mohammed, our community nurse liaison. I have Heather Thiessen, she is our WIC coordinator, and also Michaela Holm, who is our SHIP coordinator. And then we also have Shannon Templar here this morning, and she is our newest public health nurse in public health. So I'd like to start by saying how much I love working in public health and truly believe in the work that we do. I feel so fortunate to have the dedicated, caring, and knowledgeable staff that we do. This past year has been a year like no other, as we all know, and it has been very challenging for all of us. But I am so proud of the work that staff have done, not only in response to the pandemic, but also in continuing to serve our community through our different programs in many new and unique ways. This morning, I will give an overview of the programs I supervise in public health. And please refer to my 2020 annual report pages in your drop boxes for more information. And I am also happy to answer any questions that you have, and also want to invite you down to our new renovated WIC area after the presentation. So I will start with our community nurse liaison. In December of 2019, Arfon Mohammed was hired as our community nurse liaison. Her role is to build trusting relationships between public health and the community, provide support and promote health and wellness through education, connection to resources, increasing self-sufficiency and goal attainment to help meet the needs of diverse families in our community. Along with these liaison responsibilities, Arfon is one of our family home visiting nurses. She is also on our WIC team, and when the pandemic started, our phone helped immensely in our efforts to educate the community on COVID-19. And I would like to have Harphone come up and share more about her work as our nurse liaison and some of the creative ways that she bridged the communication barriers in getting that needed information out to our community. Harphone.
Good morning.
Good
Good
morning.
morning.
So, in the last year, my role, a need was met.
Excuse me, for the record, would you state your name and your position with the county? I know that Jody already did, but
So, I'm Arfan Mahmoud. I'm Community Nurse Liaison in Public Health.
thank you very much.
So, in this role, a need was met in disseminating crucial information in a timely manner. And during the pandemic, information such as importance of social distancing, hand washing, and quarantining, also how to don a mask on with a hijab on, was, among others, were provided through culturally appropriate ways, through videos and animation. Most of the videos were done in Somali with English subtitles to help both people who are bilingual, because we have Somalis who speak a little bit of Somali and a lot of English, so it helped. And due to these efforts, not only was awareness created in the community, which in turn promoted community health, but it ensured the community got access to information, trusted information from a reliable source in a time when the panic was a lot among people. So whatever we got from CDC, MDH was just given to the Somali community in a language they understood and in a way that they could understand, as compared to put on a mask was like, this is why you need to put on a mask and why it helps, especially since they live in extended family homes, and how to social distance in those homes were among the things that was discussed. Questions?
Thank you very much for that explanation. I guess before I open up for questions, I just want to say how important it is for folks like yourself to be able to communicate the importance of all the safeguards, the mitigations, and the vaccines, because it's not easy for all of us to communicate with those of different languages and different cultures, and I think this works really well. Any comments or questions for Commissioner Gardner?
Thank you, Mr. Chair. Our phone, it's great to see you, Kelly, and I miss seeing you and your lovely family out at the park.
Thank you.
So, what is it specifically that we could do to help you get the message out, especially to our communities who we know have lower rates of vaccination and have some challenges in trusting the vaccine and trusting the process?
Well, I honestly believe we are doing the best we can right now in that we are giving the information in a way they understand, and we are encouraging to get the vaccination wherever. But we also had a vaccination clinic in April 11th at the downtown plaza, and at this moment, what I understand is with the things that are going globally, like what's happening in India and stuff like that, is making the community, those who are reluctant to get more shots. And I have seen in the last 1 week that I've been getting more phone calls, and I'm sure you've been seeing more Somali people at the drive-thrus. So I think we are doing the best right now that we can.
And I understand there's another event later on this month.
Yes, there is.
Thank you so much. Great to see you.
Thank you. Any other questions or comments for? Okay.
Just thumbs up.
Well, it seems really obvious that the pandemic has really shined a light on public health. I think for a lot of us throughout the course of a normal year, you sort of get lost in the importance of things because people just aren't aware of all what you do. It would have been fun for anybody in this room. Commissioner Gardner was there last night, and so was Jenny, to be at the Kennewick County Renville Community Advisor meeting last night. Jill Bruns in Renville County is retiring after 37 years at Renville and 43 years in public health. And she told some stories that were incredibly interesting. in the work that they do in public health that the average person would not think about. She talked about when Renville had some issues with flies at the egg laying business and hog odors, and it was just amazing some of the stories that she told and what you guys all do in the course of a day's work that largely goes unnoticed by the public, because partly because you need to respect, you know, the dignity and privacy of your clients. But thanks for all the work you do, and thank you for
you.
presenting today.
Thank you, and thank you, Roger, for saying that.
You're welcome.
The next program I want to talk about is our family home visiting program. We have 5 nurses on our family home visiting team. This program is vital to the work that we do in public health. Often when people hear that you are a public health nurse, they think of home visiting, especially postpartum home visiting and seeing and holding new babies. Our agency not only offers postpartum visits, but we offer prenatal and ongoing family home visiting too. We get referrals from our local clinics, the hospital, our WIC program, and other community organizations that serve families. So why is home visiting so important? Research shows that experiences in the first few years of a child's life are the most critical. Family home visiting services have been shown to successfully decrease adverse childhood experiences, otherwise known as ACEs, and change the life direction of a child and their family. Some of the high-risk factors families may experience could include poverty, substance abuse, family stress, domestic abuse, depression, anxiety, and limited support and access to resources. And those are just to name a few. Benefits to families who receive home visiting services include getting parenting support and information that they need to better care for and parent their children, resulting in better outcomes like improved maternal and newborn health, improvements in school readiness and parent-child relationships, and improved economic self-sufficiency for families, along with reductions in child injuries, abuse, neglect, maltreatment, and domestic violence. I truly believe the success of home visiting is based on that trusting relationship that develops between the nurse and the client. Sorry, I lost my place here. Building trust can take time. It can be months of visits before a parent may share that she is experiencing domestic violence. Having a caring nurse who is there to listen, support, encourage, and nurture the relationship between moms and dads and their children makes a difference, even if it's just knowing that they mattered and that their nurse cared. When we start visiting a family prenatally and continue until the child is 3, we have more positive outcomes for that family. It does take a village to raise a family, but in some instances, having one person, a public health nurse, can make that difference in that family. In 2020, 205 pregnant women and young parents received education and parenting support through 714 visits from our family home visiting team. Supporting Hands Nurse Family Partnership made 728 visits to 72 first-time moms. Our combined family home visiting team and Supporting Nurse Family Partnership nurses made a total of 1,442 visits, reaching 277 parents and 215 children in 2020. Our visits starting in March of 2020 did look different, with most of them being telehealth. One of the many ways we had to do things differently with the pandemic, but still reach people and meet their needs. Along with home visiting, our nurses are trained and provide many other services in our community, including our expectant parenting classes, which we do in partnership with Caris Health. These are offered 6 times a year, and they include all about newborns, breastfeeding, and preparing for delivery. We also have our Baby Talk Tuesday class we do in partnership with Jefferson Learning Center. This is a weekly group led by a parent educator and one of our public health nurses, providing parent and breastfeeding support for new moms. Both of these programs, the Expectant Parent Class and Baby Talk Tuesday, have been paused due to COVID, unfortunately, but we hope to resume these classes as soon as we're able to do so. 2020 was our final year for our MEPS grant, which stands for Minnesota Expectant Parenting Student Program. Over the span of the 3-year period, a total of 101 participants were served by the program. In 2020, a total of 559 visits were made to expectant and parenting teens and young adults, reaching an average of 45 student parents each month in Candy, Ohio, and Renville County. Even though the grant has ended, the work has continued with our family home visiting nurses addressing barriers to their clients' educational goals and providing resources and needed referrals with the goal of assisting expectant parenting youth complete their high school and other educational vocational programs. The next program I want to talk about is our WIC program. WIC is our Women, Infants, and Children Nutritional Program. WIC serves infants, children up to age 5, pregnant and breastfeeding women, and non-breastfeeding postpartum women up to 6 months. The program provides nutritional education, healthy foods, breastfeeding support, and referrals to other health and community programs, with the goal of having healthier pregnancies, births, and children. We have 9 WIC staff made up of dietitians, health educators, registered nurses, and office support. Heather is our WIC coordinator, and most of our WIC staff have worked together for many years. Jenny Bernstein, one of our WIC staff, celebrated 25 years of service in 2020. They are a special team who not only care about their clients in the program, but they also care about each other. They are great friends and have fun working together. Having that positive, caring work environment makes it not only a great place to work, but a great place for families to come as clients. A WIC mom whose child is turning 5 this month and will be off the program said this about the WIC staff: "Your smiles, laughter, knowledge, and education that you have given me over the years have made it easy to be a part of the WIC program. I have learned from you. What I have learned from you, I will carry with me forever. I truly appreciate the knowledge. God bless all of you." So thank you, Heather, and to her team for the wonderful job that they do in making our WIC program so great. In 2020, the WIC average monthly participation was 1,560, with October being the busiest month for WIC with 1,656 women, infant, and children served. The exciting news for 2020 was our WIC renovation. Heather applied for and received a $96,000 grant from the USDA to remodel the WIC clinic area and offices. This allowed for the expansion and upgrading of 3 WIC offices, 2 personal offices, and 2 height and weight rooms to complete a designated WIC area in the public health. The space is now more efficient and family-friendly with larger rooms for our bigger families to allow more space for social distancing, rounded countertops for safety, wider hallways for wheelchairs and strollers, locking drawers for confidentiality and safety, and hospital-grade flooring. We look forward to seeing our WIC families in this new space. With the federal WIC waivers still in place through mid-August, our visits continue to be telehealth for WIC. Again, we would like to have you come down and tour the new space after the presentation. The next program is our SHIP program, Statewide Health Improvement Partnership. Michaela Holm is our SHIP coordinator, and she has a lot of connections in both Candy, Ohio, and Renville, as she works very closely with Renville's SHIP coordinator, Jeff Philippek. As a health educator and strategist, Michaela collaborates with community partners, including schools, workplaces, healthcare providers in Candy, Ohio, and Renville County. Candy, Ohio Renville SHIP is tasked with working to create and expand opportunities for communities to be more physically fit, eat healthier foods, and live free from commercial tobacco. So the key is to reduce chronic disease and the cost associated with chronic disease. The majority of costs related to chronic conditions are preventable. In the fall of 2020, SHIP added an additional mission that focuses on our well-being, including mental, physical, social, emotional health, and resiliency. Candy Ohio Renville SHIP implements evidence-based approved strategies to create equitable, healthy, and positive conditions that promote health for all. SHIP was also uniquely positioned to adjust work to support communities facing health-related challenges associated with COVID-19 pandemic. Candy Ohio Renville SHIP provided public health with community partnerships and connections. SHIP projects were adjusted to support community-based planning, preparation, and response to COVID-19. In 2019 through 2020, Candy Ohio Renville SHIP had 30 partner sites allocating a total of $55,826 to local community projects and received $68,055 in match dollars. Project highlights for 2020 included ACGC Elementary School Safe Routes to School Plan, implementing funding for parent and bus drop-off. Woodland Centers had virtual support groups related to COVID-19. Hope for Our City had directional drive-through park signage related to COVID-19. Candy Ohio County Food Shelf, COVID-19 resource support, multiple language signage was added. And Menu Incorporation had fruit and vegetable farm equipment. And Candy Ohio County Public Works kiosk and trail signage for biking and walking. And Central Community Transit added bike racks on 2 buses to encourage active transportation and to expand the Wilmer bike system. Thank you, Michaela, for all the work that you do for our community through SHIP and also your help with our pandemic response. Michaela helps with our Facebook page, does liaison work, strategist work, and also works at our COVID-19 clinics. She has many connections in the community and represents public health very well. She wears many hats in public health, and we are very fortunate to have her.
We probably want
Mr.
to,
Chair, yeah. If we want to wait, Jody, and we can come back to you can give your report maybe next time on the DFC portion, because we still have Corinne Torkelson with 3 proclamations to get done, and then that tour.
Sure. Yeah, absolutely.
That'd be okay?
and I just want everybody to know that Jody and I did not coordinate that message about all that they do, but it was, but I'm glad I could provide that segue for all the different things.
Okay.
Thank you, Jody, and apologize for
That is
having to
fine.
cut you a little short. We
Yeah,
need to.
just had the one.
Corinne, you have some proclamations, and this is where we added one.
Good
Welcome.
morning, gentlemen. And I do have 3 proclamations, and I'm not going to go into lots of detail at all about each of these programs because I will be coming back to do my annual report that will cover on those areas. So today we were just going to concentrate on the proclamations. Okay? And so the first proclamation up is the Mental Health Month. Whereas mental health is essential to everyone's overall health and well-being, and whereas all people experience times of difficulty and stress in their lives, and whereas prevention is an effective way to reduce the burden of mental health conditions, and whereas there is a strong research that companionship, humor, spirituality, religion, recreation, social connections, and work-life balance can help people protect their well-being and their health. And that whereas mental health conditions are real and prevalent in our county and state, and whereas with effective treatment, those individuals with mental health and other chronic health conditions can recover and lead full and productive lives. And whereas each business, school, government agency, healthcare provider, organizations, and citizens share the load of mental health challenges and has a responsibility to promote mental health and support prevention efforts. Therefore, we, the Board of Commissioners of the County of Candy Ohio County, do hereby proclaim May 2021 as Mental Health Month in Candy Ohio County. As a county board, we also call upon citizens, government agencies, public and private institutions, businesses and schools in Candy Ohio County to recommit their community to increasing awareness and understanding of mental health, the steps our citizens can take to protect their mental health, and the need for appropriate and accessible services for all people with mental health conditions.
Thank you.
Mr. Chair?
Oh, I'm sorry.
Yes.
Go ahead.
You want separate motions on these? I would.
Yep,
so
okay, so
I'd like to make a motion that we.
Commissioner Berg
approve,
moves on the proclamation for mental health care. Do I hear a second?
I will second.
Commissioner Gardner seconds. Any discussion? Hearing none, all in favor signify by saying aye.
Aye.
Opposed, same sign. Motion carries. Please proceed with the foster care month.
All right, Foster Care Month, May of 2021. Whereas the family, serving as a primary source of love, identity, self-esteem, and support, is the very foundation of our communities and our state. And whereas in Candioi County, there are currently 96 children and youth in foster care being provided with a safe, secure, and stable home, along with the compassion and nurture of a foster family. And whereas Candioi County has many dedicated traditional and relative foster families who give generously of themselves to provide nurturing, safety, guidance, hope, and love for children and families in need. And whereas foster, kinship, and adoptive families who open their homes and hearts to support children whose families are in crisis play a vital role in helping children and families heal and reconnect, thereby launching young people into successful adulthood. And whereas there are numerous individuals, public and private organizations, who work to increase public awareness of the needs of children in and leaving foster care, as well as the enduring and valuable contribution of the foster parents. Therefore, the Candioi County Board of Commissioners does hereby proclaim May 2021 as Foster Care Month for Candioi County and urge all citizens to volunteer their talents and energies on behalf of the children in foster care, foster parents, and the child welfare professional staff working with them during this month and throughout the year.
I will move that proclamation.
Commissioner Nissen moves on proclamation for foster care month. Do I hear a second?
I'll second that.
Commissioner Anderson seconds. Any discussion? Hearing none, all in favor signify by saying aye.
Aye.
Opposed, same sign. Motion carries.
Next up is our Child Care Appreciation Day, and I just do want to put a plug in for our child care providers who through this past year and throughout the whole COVID have really stood up and have been there and available for the children and available for the families, and so that people could continue to work when they were able to work, and being able to take in situations that probably were not the best for them, but they did it anyways. And so just a shout out to them for that. And so Child Care Appreciation Day on May 7th, 2021. Whereas our future depends upon the quality of the early childhood experiences provided to young children today, and high quality early childhood services represents a valuable commitment to our children's future. And whereas Candioi County has 86 licensed child care providers serving children so family members may accept or maintain employment. Whereas the contribution of child care providers to our children's future is worthy of the highest respect, and whereas by calling attention to the importance of high-quality child care services for all children and families in Candioi County, we hope to improve the availability of such services, and whereas Candioi County encourages parents to take May 7th, 2021 to show your child care provider how much they appreciate them. Therefore, the Candioi County Board of Commissioners do hereby proclaim May 7th, 2021 as a Child Care Appreciation Day and urge all citizens to join in acknowledging Candioi County child care providers and their invaluable contribution made to the children and the families of Candioi County.
Thank you. I'd entertain a motion to accept this proclamation. Commissioner Gardner moves. Do I hear a second?
I'll second that.
Commissioner Nissen seconds. Any discussion?
Just a quick comment. These three resolutions are just so awesome, every one of them. And you're talking, Jody, about, takes a village. And we are so fortunate in our community to have these kind of services over the years. I mean, this is not just this year we're doing this. We've been doing this for years, and it's so important service foster care. It's such a valuable, these are all heroes as well.
Right, absolutely. And with each of these areas, we will be doing different things throughout the month of May on working with some other agencies, just some acknowledgement for each of these areas throughout May.
Sure. Anything else? Well, thank you, Corinne.
Just a
Appreciate
vote.
that. Oh, we haven't voted. Thank you, Commissioner Gardner. All in favor signify by saying aye.
Aye.
Both same sign. Motion carries. With that, I'm going to adjourn the Kaneohe County Health and Human Services Committee, and we will meet where, downstairs. If you need to use the facilities before we go, we'll meet you at bottom of the elevator.